Hey, I'm Dr. Gregg with Align Wellness Center, and today I want to go over with you the first steps that you need to think about when you've been told that you or your child has a scoliosis. There's a lot of things going on, a lot of decisions to make, and it's really important that you have a whole picture of what's going on. So whether you've been told that your child has a 10-degree scoliosis or a 30-degree scoliosis, I want to take you through the steps and routes that you should be looking at for the different therapies and interventions that are going to wind up being the most effective for you and for your family at the different points. So we're going to start really at the beginning. Typically, we wind up calling the scoliosis a 10-degree shift or bend in your spine with spinous rotation. So we're going to start there. So if you've been told that you've got a 10-degree shift or bend in your spine, or your child has, then the things that you should be looking at doing is introducing conservative care. And the most effective conservative care has been chiropractic and or exercise or physical therapy. These two have been shown to help manage and monitor the bends and prevent them from progressing. But you've got to work with someone who specifically has training and experience in managing scoliosis cases, and not just small ones. If you know that your child has a scoliosis, you want to prepare and work with people who have dealt with the most advanced ones so that we can take care of the small ones and prevent them from getting there. As a scoliosis progresses, it typically moves along very rapidly over short periods of time. So it's important that you keep your eye on it, you monitor it, and really often as every 3 months, to make sure that it's not progressing. Because if it progresses up to 20 degrees, we've got to start looking at different therapies. As the scoliosis or bend begins to increase, it has this feed-forward mechanism, almost like a snowball rolling down a hill, and it needs stronger interventions to wind up slowing it down. So when we're at 20 degrees, we wind up finding that a corrective form of chiropractic is really essential. We found that spinal remodeling or chiropractic biophysics is the most effective way to wind up understanding the shifts and changes that are happening to the spine and work to reverse them at this point. Because at this point, basic exercises are not going to help. Other things that have been helpful are Scroth exercises, cease exercises as well, and then for some patients we wind up working or finding a part-time brace so that we can battle and overcome that sustained bend that's occurring, because that sustained bend and going through a growth spurt is going to cause the curve to progress, and we don't want that to happen. The next step we find patients in is somewhere in the 30-degree range. We just have to change our therapies to support the speed and the strength of the bending of the curve. And at this point, we need to look at a corrective form of chiropractic, which is the CBP model, and a 3D mirror image brace. Now, bracing, there's many different kinds that are out there. However, current research is saying and understanding that ones that just bend in this direction, they miss a major component of the scoliosis. So you need to find a brace that winds up addressing all three components. Now, we've started utilizing a brace called ScoliBrace that's been outstanding in winding up tracking that and correcting all three directions in one tool. Now, for some patients and people, they wind up missing this step and or they're not monitoring it often enough. We've had many patients come to us where their medical doctors have said that they need to have it checked every 6 months. We know that more often is needed because the progression can wind up be 10 to 20 degrees in as little as 3 months. So it's got to be checked at least every 3 months to see how your spine is developing and progressing if you've been told that you have a scoliosis. Because when we get up to 40 degrees and above, we've got to start to bring in our surgical colleagues to wind up providing consultations. Now, that doesn't mean that surgery is necessary. Right now, I'm finding in our community, surgeons are not looking at doing work until beyond 45 degrees and after conservative management has been attempted. Now, conservative management winds up falling into the bracing and the corrective exercise methods to wind up slowing down the spine. Most spinal surgeons want to avoid surgery as much as they can because there are so many adverse effects that can happen from it. And they use it as a last resource, just as we do. Now, what I wanted to do for you today was take you through some of the steps that someone can go through once they've been diagnosed or told that they have scoliosis. If you have more questions about you or your child's case, and you'd like to speak, I always offer a free 15-minute consultation over the phone where you can send us the information that you have, any images that you have and reports that you have, so that we can have a discussion about what's going on and then see what's going to be the best route for you to go. Once again, I'm Dr. Gregg with Align Wellness Center, and thank you for letting me be a part of your health.